Time now for Restoring the Soul of Healthcare from the HELPcare Clinic in Austin.
It is 10 minutes after the hour of 10 o'clock on a Thursday, and as you just heard, that means it is time for Restoring the Soul of Healthcare here, right now on AM 1480 KAUS, and we welcome in Lee Aase and Dr. Dave Strobel, as per the norm, on Thursdays at this time. Gentlemen, good morning, and I guess today we'll be... Good morning. I'll be speaking about preparing for open enrollment workshops, the first of which is going on tonight. Is that right?
Yeah, that's absolutely right. And Dr. Dave is not able to be with us today. He's got some continuing education that he's doing. So since this is mostly about sort of health insurance and other financial issues, I'm kind of the guy to cover that. So glad to be with you today and to talk about some workshops that we have coming up that we're really excited about, because health insurance can be really confusing and people have, choices to make. And this is the time of year when people get to pick what their health insurance is for next year. And so that period for most people starts next Tuesday. And so that's why we decided to set up these preparing for open enrollment workshops that we're doing tonight for the first time, and then we'll do the next two Thursday nights at 7 o'clock at the Hormel Historic Home. And we'll have a chance for people to better understand how health insurance works, some of the basics of health insurance, and how, depending on what plan you pick, your premiums can be a lot different. And then because of that, it makes looking at how it fits with a HELPcare Clinic membership, which doesn't use insurance. So even though we're not an insurance-based organization here, your choices of insurance can actually go a long way to maybe even covering the full cost of membership or most of the cost of membership, just depending on which insurance plan you pick.
Okay. Lee, is it true that every year, seemingly, or I guess it does happen every year, that there's changes, to healthcare plans when this comes around every year? Is that accurate to say, or? Oh
yeah, it's very much the case. And as it turns out, the insurance companies, and then if you've got employment-based insurance, if your employer is contributing toward your insurance, they're sort of negotiating over the costs. And, we've heard some reports of people of organizations having their cost for insurance go up 30% in this last year in the renewal. And so that gets divided between the employer and the employee, and they, sort of figure out what's at least tolerable, or hopefully tolerable for each side. So that's part of what goes on. But then there's the Medicare open enrollment time, and then for MNsure, which is the state Affordable Care Act, clearinghouse, there are various plans that are available there as well. And there's some tax subsidies, some tax credits that are available for people depending on their income to help support that. So yeah, there's a whole lot of changes. There's a whole lot of options. And that's where, and then beyond that, just for people who choose to use a non-insurance option like, Samaritan Ministries or Medishare or some of these other health sharing organizations, there are some pros and cons of that kind of approach as well. And so the idea behind this workshop is to just have a really good conversation, good discussion, where we can lay out some of the things people should be aware of, some of the things about how choosing their deductible wisely, and then combining it with the HELPcare Clinic membership can mean that those high deductible plans that sometimes people might be a little bit scared of in the first place is say, oh, well, the deductible is really high. But if you combine it with a HELPcare Clinic membership, which covers most of the care you need for most of your life, people can feel a lot more comfortable taking that higher deductible and saving the difference in the premiums. And so we'll kind of talk through what that's like, and just how, we are not financial advisors. We're not offering, this is for educational purposes. This is just to give people some information so they can make their own decision, and they can talk with their trusted advisors, and they can have kind of a good introduction to, so this concept of a membership instead of insurance, is different. And so how can I understand that better and what the implications might be for me?
Yeah, exactly, Lee, and obviously to have that local presence right here with you guys, to help help our listeners who might be interested, like you said, through these myriad of plans and what might be best for them, and like you said, obviously coming on board with you guys, and that where you're talking about the deductibles, and obviously it's unfortunate that it's that. I guess complicated to the point where you tell some people, boy, you're going to save money, with this plan or that plan or doing this or doing that, but it's just they're so intimidated by delving into it. I guess to begin with, do you think that's accurate to say? Or?
Oh, it surely is. I mean, I was on the MNsure website and I was looking through some of the various options, and there's some you wonder, so does this include Mayo Clinic coverage, and some don't include Mayo Clinic coverage, because it is important to have something that covers, if there's a catastrophic event, if there's I had spine surgery early this year and it was a 6-figure kind of thing.
Yeah.
And having that insurance was really important, so it's necessary to have this. But I think one of the things that we're able to offer is a chance to really demystify some of that, to help people better understand the implications of various choices, and also to have a little bit more confidence that, if I were to go with a membership and go with a higher deductible, that a lot of these things that would otherwise be part of my out-of-pocket expense are already covered, they're already included, and so you kind of have that nailed right there, and then you keep insurance for what it's supposed to be. Insurance on your car and insurance on your house is there in case you have some catastrophic event that could financially ruin you, but it doesn't pay for your day-to-day kind of things. And whereas health insurance has kind of gotten off track by including a lot of these day-to-day things that really wouldn't have to be that expensive, but because they go through the insurance system, they get more expensive. And so that's part of our mission too, is to help people better understand that.
Yeah, exactly, and to help, like we said, declutter and decomplicate things, and it's right, obviously, in a service available right here in Austin. So you can't beat that, and just the ease of basically coming to you guys, and like you just said, helping everybody make the choice that's best for them. It was mentioned when they stop by and talk to you guys.
Yeah, and we're going to try to get some other resources from the community as well. With MNsure, there are some folks that are local that are assisters, I think is what they call them. They're people, and so we're going to see if we can engage with them, with one or more of them, and see if some of them might be able to provide some more insight, particularly on that program. But what we're encouraging people to do is bring their open enrollment materials with them. And if they have some old medical bills that they want to bring as well, to kind of see, so how would this apply in depending in a different system, then we can, we're planning to have just a real informal discussion where people can ask questions and kind of, to the extent they're willing to share what their, perspective is, or their, the options that they have. I'm going to use the example that I have as a former Mayo Clinic employee, and I have Mayo employee insurance. And so what are those implications, and how, if I choose one versus the other, what difference does that make? But then we'll encourage people we'll give them worksheets, that they can work through their own situation and say, okay, I've got option A and I've got option B, and one, here's the difference, and then what's the monthly cost savings, and then what is that deductible, and how could a membership cover most of the stuff that's in that deductible for probably less, significantly less than what that deductible is.
Yeah, that's for sure. And as you said, Lee, concerning MNsure and the open enrollment period, like you said, that gets underway next Tuesday, November the 1st. And, again, with your event coming up, I guess, we can repeat, I know what you said, it's at the Hormel Historic Home, and it's and repeat the information of what it's going to be and things like that. Yep,
we're meeting at 7 p.m. at the Hormel Historic Home, which is a block from HELPcare Clinic. So it's right close by, so people on the way can stop by and take a look if they'd like. But we're meeting at 7 p.m. to 8:30. We'll be done by 8:30 every night. And this is tonight, as well as then November 3rd and November 10th. And so that gives people, opportunities, they're all going to be the same workshop essentially, except for the discussion that happens because of different people there, but we'll cover the same material. We also have our booklet called Saving Through Membership that we'll be handing out for folks who are attending, that gives them a better understanding of the whole healthcare clinic model, as well as then those worksheets that they can use to investigate their own open enrollment options and make their choices. So they can sign up by going to our website. We've got a blog post called Preparing for Open Enrollment, and there's links to where you can sign up online. Or if they'd like to do it the simple way, they can just give us a call at 507-279-2345. It's 507-279-2345. And we'll take your name down and plan to have you there. We'll have coffee and water kind of refreshments, at least this first time. Maybe in the future we'll have some low-carb snacks and keto-friendly snacks. But that's more what we offer here in the clinic. If people want to stop by for a tour, see their, take a look around, we'll give you a keto scotcheroo or crackers or some other kind of dessert that we have that can show that, eating healthy can actually be really tasty too.
Yeah, exactly. That's for sure. Well, Lee, great to have you with us as always here in our 10 at 10 feature on Thursdays, Restoring the Soul of Healthcare. And again, the Preparing for Open Enrollment workshop being hosted, as mentioned, by here tonight. And that, again, is this evening at the Hormel Historic Home from 7 until 8:30 p.m. And Lee, as always, great to have you with us here on right here, right now on Thursdays for our 10 at 10 feature, and encourage everybody to stop by that workshop taking place tonight at the first one at the Hormel Historic Home.
Thanks so much. Glad to be with you.
You
Have
bet.
a great weekend.
You too. Take care.